Hello, everybody, and welcome back to Coming Clean with Indy Lee. I'm your host, Indy Lee, and today I am really blessed. I'm sitting here with Lilly Stairs. And Lilly, we first met at the congressional hearing, I think it was almost 2 years ago, for American Autoimmune Related Disease Association. And I can truly remember you talking about your story and how you got involved with the community, aka AARDA. And I'll be honest, I was like tearing up in the audience, just your passion. And so I'm so happy you were here to share with us. And by the way, congratulations. You are now the interim CEO of AARDA. So very excited for you.
Oh, thank you so much, Indy. And thank you for inviting me to be here. I am such a fangirl of your work and all that you do, and am so grateful that you've come on board to support the autoimmune disease community as an autoimmune disease patient yourself.
I didn't realize that there were so many resources available. And that's why I'm so happy that you're here to talk and really share this information and what people are going through. Now, this podcast is all about, becoming present, sharing your passion and how that became your purpose. And I'd love if you would share a little bit about your autoimmune journey and how you kind of came to be a patient advocate as well.
Yeah, absolutely. So I am a 3-time autoimmune patient. So I'm, lucky to have all 3. I have a friend with a few autoimmune diseases who says autoimmune diseases are like a chip. You can't have just one.
Oh my God, so true.
Yeah, it's so true. So I was diagnosed with psoriasis at the age of 7. And, I went through a lot with that in that I was doing topical steroid treatments. It looked almost like chicken pox over my whole body. And that was hard for me mentally. It made me feel different. It made me feel icky, like people were looking at me, like I looked weird, like I had some sort of weird contagious condition, which psoriasis is not contagious. So I would actually go get up every morning before elementary school, and my mom would drive me into the city to get these light treatments to treat the psoriasis. So,
Gosh.
that's where it all started. And what's really upsetting is that at that time, nobody referred to psoriasis as being an autoimmune disease. It was really just a skin condition, quote unquote skin condition.
Yeah, my sister has it. My sister has psoriatic arthritis.
And there is a systemic component to it that it is, and the psoriatic arthritis piece, 30% of people with psoriasis will get psoriatic arthritis, but nobody ever mentioned that either. And 30% is a significant number. That's not a small statistic. That's not rare. That's pretty large. So, fast forward to me turning 19, and I had just wrapped up my freshman year of college and loved it. I was at Northeastern University in the city in Boston and couldn't wait to get back. I was home for the summer and started to have this pain in my knee. I thought it was a workout injury, started going to physical therapy. And then I went on vacation to Maine with my family. And every morning I started to wake up and feel achy. And I thought, maybe it's just the beds. We're in a weird place. We're in a different place, and the beds aren't, great, super luxurious or anything. Right. But then I'm like, oh, I'm in college. I could sleep on a floor somewhere and be fine. So it didn't make any sense. And then we got home, and one day I woke up and I literally couldn't move. I was paralyzed with pain throughout my entire body. And so, of course, that started a whole series of testing and going to the doctors. I remember when we were chatting, you said that you thought you had Lyme disease. That was where my head went first, or parvovirus. And so we started getting for all
exactly.
stuff. Yes. Negative. But I had these really high inflammatory markers, like dangerously high, and did end up getting the psoriatic arthritis diagnosis. And I was just devastated because here I am, 19, seemingly very healthy. And I was so sick, and to have this arthritis diagnosis, I'm like, well, old people get arthritis, not somebody my age. That doesn't make any sense. And come to find out, arthritis is not an old person's disease. And there are a lot of people.
Same thing I said. Thing I said when my doctor said, I think you have rheumatoid arthritis. And I said, I'm too young. And he says, it's not an old person disease.
Right.
And I was like, wait, what?
And so many people don't realize that. So now I got my second diagnosis on board, and I was really going through a lot to try to get that under control, trying and different medications. And it's a lot of trial and error in autoimmune. We don't have all the answers. And so you sort of have to try different things to find the right cocktail that works for you. And it's no one size fits all approach. So 6 months later, after receiving the psoriatic arthritis diagnosis, I ended up with this unbelievable stomach pain, unlike anything I'd ever felt before. It came out of nowhere. And I was in and out of the ER 3 times in one weekend. In and out of the ER 3 times in one weekend because the nurses and physicians, unfortunately, seemed to think it was all in my head. And thought that I was seeking narcotics, thought that, it was a mental thing.
Which is, I believe, very common, Lily.
Very common.
Especially when it comes to these pain and they're unable to pinpoint it, right? And then just give you a pill. They think you're looking for a pain pill.
Exactly. It's devastating. Indy, I talk to so many women living with autoimmune conditions, and they all have a similar story to mine. At some point in their journey, they've experienced dismissal or disbelief by folks in our healthcare system. And it's the way that our system is designed. We're not training medical students properly. And it's also some of these inherent biases that we have with women and not believing them. And so it's something that needs to be addressed. And it's particularly difficult for women with autoimmune diseases. And 75% of people with autoimmune diseases are women. So it is really a female problem. But anyways, so I could really do a whole nother podcast on just that.
We will.
So finally I'm admitted into the ER, and I'm there for 2 weeks. We run through a series of different tests. Finally, they say, we've got one more test we can do. If this shows nothing, that's it. We have nothing else to do for you. So I took this pill that had a little camera inside of it, and it took pictures as it moved through my body every 3 seconds. And that was when they discovered bleeding ulcers in my small intestine and diagnosed me with Crohn's disease. And so here I am, 3 autoimmune diseases, right? 3 at the age of 19, illnesses that I'm going to live with for the rest of my life. And I pulled up my computer and I started Googling. I typed in all of these conditions, and what term comes up but autoimmune. And I was so angry because I had never heard the term autoimmune before, but come to find out there are 50 million Americans who are living with an autoimmune disease. And so it really was from that moment in the hospital bed. I didn't know what patient advocacy was at the time, but I really knew it was going to be my calling to do something to change this.
I have a quick question on when you got the diagnosis of Crohn's. Did you feel a sense of relief that you finally knew and that they were hearing you?
Yes, I did. And I don't know if you hear my kitty. He's trying to. He wants to be heard on
he also wants to be a part of this.
He's like, tell my story too. Yes, I was very relieved, actually, in a weird way, because honestly, I was terrified, and I didn't know, like, am I dying? Am I like what's happening here? Because nobody had answers, and they would just come in and they'd poke and they'd prod, and I just felt so isolated and, really like my life's flashing before my eyes. Is this it?
You don't know if you're dying.
You don't know if you're dying because they don't have the answers. And so that was scary. And there's always that relief that comes when you find out, okay, I don't have something terminal, but it's still lifelong. Yep. And I don't feel that I really got a whole lot of clarity. I mean, my mom and I were talking about this recently because she was there with me. She said she even tried to type in Crohn's to Google and she spelled it wrong. And they're like, wasn't because they didn't give her the information. And so she started Googling it. She's like, oh my God, like this must be rare, doesn't exist. Like it's not even coming up on Google. So there was a disconnect in the actual diagnosis when it happened too.
And I think that's still very common. I heard you say, and I know so many people who are living with autoimmune, it is very isolating.
Yeah.
and can lead to depression. And here we are in the midst of a pandemic with autoimmune, those with immune compromised systems being at higher risk. So further isolating socially/physically is just making it even harder. And that's why I think the work that you're doing is more important now than ever. Truly.
Yes. Thank you, Indy. Yeah.
Thank you.
Thank you. Well, thank you for championing the cause and calling attention to this, because it is something that our community is struggling with right now. And of course, our whole world is struggling, right?
Yeah.
Autoimmune condition or not, it has been mentally taxing on everyone. But there is this weight that autoimmune disease patients are carrying. And, part of that weight is the fear and the heightened risk for somebody who is immunocompromised, and the fear of getting COVID, that, could this trigger my autoimmune conditions? Could this send me into a flare?
Could this kill me? Can my body not fight it off?
Exactly. So there's that. But then there's also this feeling that society doesn't really care about us, right? Because there's this sense of, well, if you're immunocompromised or you're high risk, why don't you just stay home? Well, so that we can reopen and so that we can do things. It's the idea that, like, oh, if you have problems, just stay home. Like, that's on you. And it is that, like, our lives mean less.
Yep.
And that's a weight. That's a heavy burden to carry. And
it is. It truly is. And you don't know. And again, exactly what you said. It's so isolating, and people don't understand it. Unless you have it, you don't understand. People are like, oh, what do you mean you have a flare? Or what do you mean you're in some pain? Like, I know, the pain is like nothing I've ever experienced. When I have a flare, it's like, sometimes you can't breathe.
Oh God. When I was in the hospital, it was dark. I said, if I have to live with this pain, if we can't treat it, then this is not a life worth living, because it was so bad.
And that's, Lilly, that's the part that I hope people are hearing. And I'm hoping that other patient advocates and other people in the medical industry are hearing that when someone comes in presenting with something that is not necessarily hitting all the markers of what they can check off, hear them. The pain could be excruciating.
Yes, absolutely. And I think there's this, and you bring up medical professionals and disbelief and dismissal, and thinking creatively, I think, is important too. So understanding that autoimmune can present in a lot of different ways. And when I got my psoriatic arthritis diagnosis, nobody ever thought about Crohn's, because Crohn's, they always just think is, isolated to the GI tract, but it's not. We actually, fun fact, we don't know if I have psoriasis, psoriatic arthritis, and Crohn's, or if I just have psoriasis and Crohn's, because arthritis can also be a symptom of Crohn's disease. So it manifests differently. So sometimes you could have somebody who goes to a rheumatologist first with joint pain, but the rheumatologist doesn't make the connection to Crohn's, because maybe they're not asking about the GI piece, because they're focused on a certain part of the body. And so it is challenging specialists to really think a bit outside of their own box and body parts and look at the patient holistically, as opposed to just thinking about that one specialty that they serve.
And I think that's another part of this that I'd love to discuss is, you were saying most people, and I don't know the statistics, and I'm sure you do, that the people who have autoimmune typically have like multiple autoimmune, right? So there's multiple. And so how do you know the percentage of that?
There is a study on this, and I'll have to find it so that you can link to it in the show notes. About 25% is what they estimate. I would guess it's more than that. And this is
based
undiagnosed. Yes, undiagnosed. Or, symptoms are overlapping. And so you don't necessarily see, like the Crohn's, do I have Crohn's and psoriatic arthritis, or do I just have Crohn's? I think there is a level of diagnosis that are not happening. Yeah.
And I think that goes to the point of, it's so hard to pinpoint. There is no autoimmune doctor. You have so many specific specialists that that aren't necessarily in the same practices, who know each other, where you're cross-referencing. And as a result, every body is different, like literally every physical body is different, and diseases can be presented differently. And then couple that with the ability to, most people have multiple ones. So they're like, I don't know what's going on,
Yeah.
which is, I'm sure, very frustrating for those in the medical community, but certainly very frustrating and debilitating for those who are living with these multiple diseases.
Absolutely. And, one thing I will encourage for anyone who's listening who is dealing with that struggle, there are some autoimmune centers of excellence across the country. One of them, AARDA, is partnered with in particular is the Autoimmunity Institute at Allegheny Health Network. And they're out of Pittsburgh. They see patients from across the country, and they actually bring all of the different specialists together, and they huddle and they talk about, complex autoimmune cases. So that's their specialty, is autoimmune, which is amazing. But what's difficult right now is that you have to go to there are only certain centers of excellence where that's happening, right? It's not happening across the board. So, and not everybody.
Not yet.
Yes, not yet. But yeah, we're fighting for it.
So that brings me, perfect segue. That brings me into AARDA.
Yeah.
Right? Now, AARDA, for those of you who have not heard me say it a gazillion times on social media, is the American Autoimmune Related Disease Association, which is Lilly is a board member and is now the acting interim CEO. How did you get involved with AARDA? And can you tell people, the listeners, what AARDA is doing and the importance of it?
Yeah, absolutely. So my journey with AARDA started again when I was in college. I actually, after I got my diagnoses, I had a couple of years of trying to get my conditions under control, went on a series of different, what we call biologics, and was lucky to find one that has actually kept me in medically controlled remission for 7 years now, which is
amazing.
And so my senior year, I decided I want to give back. I want to do something to make a difference. And I had come across AARDA and was so excited because I was like, oh, it's an organization that finally is acknowledging all of these different conditions that I have, instead of just piecemeal each one and, being in individual silos. And so I was like, I want to raise money for this organization. I want to raise awareness. And so I'm a builder of campaigns. That's really my background is in marketing and communications. And so I said, I want to run an awareness campaign, and recruited a bunch of friends, bless them. I like made them all my little, my team, and I gave them all assignments. I had one who was running PR, one that was running, admin, somebody doing events. And like, they're such good friends because they were such good sports and did a lot of work for it. But we came up with the 50 cents for 50 million campaign. It was this idea that, if we could just get everybody to donate 50 cents towards raising awareness for and funds for the 50 million Americans living with an autoimmune condition, we could really make an impact. And so that was one piece of it. That was the base of the campaign. And then, we ended up getting Scion. The car company gave us a car to travel around to New England and bring gift baskets to kids and teens living with autoimmune conditions. We dropped off strength bunnies at stuffed animals at Boston Children's Hospital for autoimmune disease, kids living with autoimmune disease. We also did a comedy show to raise funds, and we ended up raising, like, over the course of 2 years, and I had somebody else take over the campaign after me. We raised about $25,000 for AARDA as like a grassroots initiative. And so Virginia Ladd, who was the founder of AARDA, and she reached out to me and said, we're looking to expand our board. We'd love for you to apply. And so I ended up being on the AARDA board, and I've been on the board for about 4.5 years, and now have just stepped into the role as interim CEO. And I'm so grateful for it because I'm so passionate about the work that we do, like you are, Indy, and what we are doing at AARDA. So I believe that was the second part of your question. We cover a lot of different areas. We're definitely keep busy. So, at our core, we do work to provide education to patients and caregivers. And we have a call line, and we also have an email. that you can get in touch with us in addition to our website to help answer any questions, to help support you if you are undiagnosed, to help point you in the right direction of these resources. We'll also, if we have folks who come in, with a specific diagnosis, we will also help direct them to our coalition partners. So we're partnered with over 40 organizations like the Lupus Foundation, the Arthritis Foundation, and psoriasis. And so we'll help get them connected into their respective organizations as well. So that's one piece, the education and awareness. We also are in the policy space, and that's where you and I met on the Hill in Capitol Hill, and really are fighting against policies that are harming patients, things like step therapy, which is one of the issues that we were talking about, Indy, when we met, and this idea that patients are being forced to fail first on therapies instead of going directly to the one that their doctor wants them on because their insurance is making them try cheaper medications first. And the problem is their diseases are progressing during this time.
Yep.
Sometimes to the point that they end up needing a surgery or they have permanent damage. And so,
they're degenerate. Many of them are degenerative diseases.
Exactly.
And so once you start having that degradation, there's no going back.
No going back. And so we are actively fighting those policies. We've actually, and recently in December, we in Massachusetts were able to pass reform around that, which is very exciting. And so we continue to go state by state and also working at the federal level. So that's another arm of the organization. And then we are also involved in general fundraising we want to fund research, right? Some of this basic autoimmune research is critical to us really being able to move the needle for treatments and cures down the line. Because if we unlock what's happening at the basic level for autoimmune conditions, it's going to make an impact for all of the over 100 conditions that exist. So we do a lot of work funding some of that basic research.
I love that. And I think that's an important part for people who are listening, that there are over 100 diseases that we know of.
Yes. Yes.
And even the 50 million, I truly believe is understated because of the lack of diagnosis that goes on, or for people not believing because somebody didn't listen to them that there actually is an underlying disease.
Absolutely.
Because they run the spectrum. Some of them are easier to test for, others of them not so much. A perfect example is myself with my RA markers. I tested negative, but then we went through all this testing, additional testing. And I was very lucky to have a doctor who believed me. And I was showing all these very concrete signs. It was check every box. And he's like, no, you have RA. And when I went on the methotrexate, all of a sudden, within 2 weeks, my symptoms were gone. And he's like, you can't argue with that. And he said, despite having negative tests. And I said, how is this possible? I go, am I just some weirdo? He said, no, it can be 50% of the people who have rheumatoid arthritis aren't necessarily testing positive.
Isn't that crazy? And that's
insane.
And RA is one of the only autoimmune conditions that we actually have concrete markers for. We actually have a lot of testing that would indicate a definite yes or no in the direction of specific autoimmune diseases. And so we've got a lot of work to do, even, not only in treatment, but also on the other side, right? On the diagnosis side and using some of those diagnostic 100%. Tools. And then in treatment, also some of those complementary, whether it be tech or food or nutrition, I think there's a lot that we can be doing on that side of things too.
I made this transition to also speaking with an integrative physician.
Yeah.
And it has changed my life. Dr. School, if you were listening, you changed my life because she really listened and looked at me holistically. And we started to change my diet. We started to change a lot of different things and even just, healthy supplements I was taking. And I just was living a fuller life as a result.
Yes, absolutely. And I think there's a lot of opportunity to marry some of the Western traditional medicine alongside nutritional choices and supplement choices that and acupuncture and some of that other stuff, whatever works for you. I mean, I think that sometimes people can feel a lot of pressure to have to like totally transform their diet and never eat pizza and never eat. And that's
right. We were talking about this.
And it's not always the case, let yourself eat the cake, I believe is what you said.
That's what I said. I know I'm not supposed to, but
yeah.
But sometimes I'm just going to have it. And in your case, you're like, I need to, every once in a while, I need to have that pizza.
Yeah.
And that's the thing. Just because you're living with autoimmune diseases doesn't mean you cannot thrive.
Absolutely.
And I think that's what AARDA is really about, is helping people go from diagnosis to thriving. And that just doesn't include the medical side. It includes the support to the community that you're providing, which I think is, well, you know how I feel about this. I'm very passionate about it. So I have a question. How do you feel that COVID, and we touched on it a little bit, but how do you think it has impacted the autoimmune industry, and has it impacted the awareness of AARDA?
Yeah.
Now that everybody's talking about autoimmune, immune compromise.
Yeah. So, certainly, of course, COVID has really taken a unique toll on the autoimmune community, as we discussed. And I think that AARDA has been able to step up. I'm really proud of our organization for the work that we've been doing to support patients during this time. We were able to pull together a webcast with the CDC to provide information on what COVID, how it can impact the autoimmune community. We are going to be doing one around COVID-19 and vaccines as well, because I know that there's a lot of fear within our community surrounding the COVID-19 vaccine and how that might impact autoimmune patients.
Raising my hand right here.
Yes, you have to tune in to our
believe me, I will be.
Yes, we're bringing the CDC in. We're bringing, physicians. We're bringing in a patient who a friend of mine that I saw yesterday evening, who she is also living with RA, and she did get the vaccine, and she's doing wonderfully and has had no side effects, no issues, which is great. So, we'll be talking about vaccine equity and, how that impacts the Black community as well, and vaccine hesitancy there. So we're really tackling some of those health equity issues too.
Yeah, that's another part that I wanted to bring up, and I just hadn't gotten to it, is when we talked about statistics, right? Yeah. We said, 50 million Americans, and that was a statistic that we got a few years ago. So I'm not sure what it is at this point. And then we said 75% of them are women. How much of that 75%, or even of the 100%, are in the BIPOC community?
Well, Indy, the unfortunate answer to this is that we don't have accurate statistics around that. And part of that is because people in the POC communities are more likely to go undiagnosed. Because,
it's not okay. I get so emotional about it.
Start with the fact that women are not taken seriously by the healthcare system. Often they're dismissed or they're disbelieved, but amplify that for Black women, right? And Latinx community. That's just the reality, unfortunately. And so I actually don't have a direct statistic, and there is probably one that exists, but I have to say that it's very likely not accurate. It's probably a lot higher. Yeah. It should be higher than whatever it is.
And that's a reality, again, as we start to talk about what the pandemic is bringing up, and also being in the midst of a civil rights movement. But again, it just, amplifies the need for us to raise awareness and provide support and help, so that in those marginalized communities, they can get the diagnosis that they deserve, and then have access to the healthcare that every human deserves.
Absolutely. I could not agree more. It's something that health equity is so important to myself. It's important to the AARDA team. We're working to, and health equity across from POC communities to folks who are in a lower socioeconomic status. As we looked at with this pandemic, how it's forced all of us to go virtual. There are a lot of people who, maybe for you and I, Indy, it's been easy for us to make that transition because we have access to reliable Wi-Fi. But there are a lot of people who, one of our colleagues at AARDA, her husband is a teacher, and in his community where he teaches, only 30% of the children had access to Wi-Fi when they needed to go to virtual learning. So this is a reality in our country, in our world, and there is more that we want to be doing. So we're trying to focus some time and energy on these, what I like to call boots on the ground initiatives, which are geared towards really getting into communities and delivering some of these resources the old fashioned way via, a magazine or a pamphlet.
However you can, because if they don't have internet, they're not looking at websites, maybe social media, which is how I certainly am planning on trying to make as much of an impact as I can with you. But there's a lot of work to be done. So you have a lot on your plate. I honestly don't know that you sleep. We'll have that conversation offline. So it's clear to everybody listening how you took your passion and made it your purpose. But how do you stay present, and how do you take care of yourself when you have so many things going on?
I love this question, and more people should really ask it, because we should be encouraging more of this work-life balance. I will say, I like to think I'm really good at work-life balance. I am a great sleeper. I value sleep. I do try to get 7 to 8 hours every day. I know that's having an autoimmune disease, autoimmune diseases has forced me to take good care of myself, right? Because if I don't, then I risk flaring. And so I prioritize sleep. I prioritize eating healthy with my cheat meals on the side. But I also, to stay present, that's actually a priority of mine this year. It's something that I truthfully haven't done well in my life, being a type A personality and always being like, what's next?
Card carrying.
I'd say I checked this box. So on to the next thing, and thinking about the future. And I am like, I need to live my life. I need to be more present because you never know when your last day will be. And that was something I had a teacher in high school who always said, and it's always stuck with me. And so I'm trying to really be more in the moment. And some of the ways I'm doing that this year, I've actually made a vision board. And I spend some time with it every morning. And part of what
you are making my heart sing. I love it.
is being present with that and gratitude. So having a gratitude journal. So that's how I've been starting my day. And I have to say that's really positive.
Oh, I'm so proud of you. Yes. Yes. That's fantastic. I talk about it all the time, and that's why I do Mindful Mondays on Instagram. And people are like, this is weird that a beauty founder is doing a Mindful Monday. But the truth is, all we have is right now.
Yes.
And that's why I'm so committed to helping raise awareness so that people can have and thrive in the now. Yes. So I'm so happy to hear it. Like, gratitude journal, vision board. I meditate every morning and every night. I write affirmations or say my affirmations every day. I do visualizations every day. I've really started to take my mornings and wake up really early so I have time to prioritize me and work on my own self-development. Like, how can I continue to grow if I'm not making time to develop myself?
I love that. Meditation's on my list next. I've struggled with that one, but it is something.
Every day I struggle with it. I think that's the purpose. Like every day. Although lately, because I've been so consistent, I'm getting into that hum section where I'm like, okay, I think I just quieted my mind. I think my body's actually like, I can feel it humming, like vibrating. This might be it. Okay. But then I go out of it. But that's the practice. It's just, you learn how much we have in our minds and actually how unkind we are in our minds to ourselves.
Yes. So it's good to hear you say that, because every time I sit down to do it, I'm like, I can't do this. I don't have I think we're similar in personality. Go. And so it is on my list though. Oh, and exercise. I love to work out. So that's the
Okay, that's the one thing that I have not mastered, but we're getting there.
I love it. Well, I have a workout class that it's amazing. It's called Bar Groove, and everybody has their own trampoline, and it's a mix of trampoline and bar. And so I'm obsessed with it.
But you know what? That's what I hear. When someone finds it, they become obsessed, and that's how they incorporate it, and it becomes a habit, and certainly a habit I need to start working on. I know I'm going to do it. So, Lilly, thank you so much for spending time and giving. I know how valuable your time is, and I don't know how you squeeze me in, but thank you. How can people find you and the work you're doing?
Thank you, Indy. Well, thank you, because I know you're super busy. So thank you for dedicating time to the autoimmune community. So you can find AARDA, first of all. We're on Twitter, Facebook, Instagram. We're at AARDA.org. And we're at Autoimmune Diseases on Instagram. We're at AARDA Tweets on Twitter. And then you can find me on Twitter at Lilly Stairs, Lilly with 2 L's and stairs like going up and down. And you can find me on Instagram at Patient Authentic, which is a business, my consulting company, where I build programs to help empower and educate patients.
And I will make sure all of this is in the show notes. Lilly, thank you. Thank you. I truly appreciate you and everything you're doing.
Thank you, Indy. Right back at you. So glad we can collaborate.